FSH stands for follicle stimulating hormone, and it's a hormone that is used it's released by a gland in the brain called the pituitary gland, and it's used to stimulate the ovary to release one egg each month. And it works on a series of negative feedback. If your estrogen is low, the brain produces more FSH that makes you release an egg, and then once the egg is growing and the estrogen levels rise, it gives negative feedback to the brain, and the FSH level goes down. And this is what is done through with each menstrual cycle. Um, Now, women with polycystic ovarian syndrome tend to have normal or sometimes slightly raised estrogen levels, and because of that, they tend to have low FSH, either normal or low FSH levels. So that is it's one of the tweets. If the women have raised estrogen levels, then they'll have low FSH levels. If their estrogen levels are normal, then their FSH levels are normal. And FSH is sometimes used as an indirect way of measuring a woman's ovarian reserve. And that if a woman has a low FSH, which is typical in women with polycystic ovarian syndrome, it implies that they have lots of eggs. There are many eggs there, and so it's an indirect way of estimating a woman's ovarian reserve. If a woman's FSH is high, and what I'd say is we consider a woman to have a good ovarian reserve if her FSH level is less than 9. We consider her to have polycystic ovaries if her FSH is less than 3, because that shows that she has lots and lots of eggs. And we consider her to have a low ovarian reserve if her FSH is above 9. Okay, and with FSH levels over 14, we tend to think of a woman as being perimenopausal, and if it's over 30, sometimes that's diagnostic of being in the menopause.